comprendre effectivement que le problème est ensemble et qu'avec les DMI, on peut aussi en même temps empêcher la venue des enfants pendant ces périodes très difficiles et surtout que les services de santé étaient fuis. Donc, ça a quand même permis de faire la sensibilisation aussi bien pour la PF et aussi bien pour le DMI. Et le DMI, il y avait déjà des produits qui étaient déjà préparés à l'avance. Et c'est ça qui a été très, très utile. Donc, ça a fait qu'on a pu éviter les ruptures de stock, surtout des contraceptifs, pendant cette période. Et les contraceptifs étaient gratuits, étaient disponibles. Et ça a encouragé les gens à continuer à venir demander les services. Donc, ça nous a permis d'assurer la continuité des services, ce qui a montré que les deux allaient ensemble. Et ça, c'était quand même un peu rare. Ça nous a quand même permis de faire ce travail-là. Et en plus, comme on a eu à le dire, pendant la COVID-19, les services étaient complètement désintégrés aussi à un moment donné parce qu'à cause de ce problème d'infection et à cause de ce problème que les personnels de santé ont littéralement fui même. Mais quand on a réussi quand même à les former eux-mêmes et à leur fournir des équipements de protection individuelle, ça rétablit aussi la confiance dans les services. Ils savaient qu'ils n'étaient pas seuls, qu'il y avait des gens là qui s'occupaient de leur santé et de leur travail en leur fournissant des produits, des outils pour travailler. Ça a vraiment renforcé quand même la confiance des prestataires. Donc, on peut dire que ça a joué un rôle quand même positif. Bon, je ne souhaite pas que les catastrophes arrivent. Mais dans ce cas, on a tellement bien joué sur les deux que ça a apporté un rôle assez positif quand même, non seulement sur la maladie, mais sur le personnel de santé et sur la limitation des dégâts. Et surtout, ça a permis de continuer quand même les services parce qu'on avait fait en même temps une étude au tout début, au mois d'avril, au mois de mai, on avait fait une étude avec l'UNFPA pour voir quel était l'impact justement de cela. Et ça nous a montré beaucoup de choses. Par exemple, ça a montré également qu'il y avait une augmentation de violences sexuelles. Le début de COVID-19, il y avait une augmentation de violences sexuelles. Il y avait les jeunes surtout, les adolescents, eux, ils étaient vraiment très résistants à ça parce qu'ils ne se croyaient pas, comme on parlait beaucoup plus de personnes âgées, et ils ne se croyaient pas du tout impliqués là-dedans. Et avec la sensibilisation, les jeunes également ont quand même commencé par comprendre qu'il n'y avait pas une limite, comme on le disait, que c'était eux, ils pouvaient très bien aussi être non seulement atteints de Covid, mais avoir en même temps des grossesses non désirées, non planifiées. Donc, ça a permis vraiment d'enrichir les outils de plaidoyer, de sensibilisation auprès de tout le monde, je peux dire. Et ça, c'était quand même des choses que nous avons apprises par cette étude-là, qui a apporté beaucoup d'éléments et qui nous a permis aussi de prévoir les éléments, surtout dans le sens de la sensibilisation et du plaidoyer. Je crois que si vous avez d'autres questions, je peux répondre à cela, quoi. Ça, c'était un peu le côté positif.
Thank you so much, Dr. Grace. I appreciate it. I guess we could, as long as you're with us still, and I haven't heard from the organizers yet, that we'll go forward. But would you want to expand a little bit more on the steps that have been taken in Chad to prepare to be able to deliver the SRH services in humanitarian crises?
Oui, le ministère, comme je l'avais dit, notre cluster est basé au niveau du ministère du Plan, qui évidemment, il coordonne non seulement les ministères, mais les ONG, les agences des Nations Unies. Et donc, il est un peu le bras droit du gouvernement pour pouvoir atteindre tout ce monde. Et je crois que la première chose que ça a permis d'abord de voir ça, c'est que les besoins étaient identifiés, étaient partagés, discutés, et les planifications, la programmation étaient faites ensemble. Donc, on a par exemple compris que c'était important que les services continuaient. Et là, il fallait maintenant, il manquait évidemment beaucoup de produits, il manquait des produits, donc il fallait acheter les médicaments, il fallait continuer à former les gens, non seulement dans la capitale. Au début, on a formé le personnel de santé dans les maternités, dans les centres de santé au niveau de la capitale. Mais après, on a étendu cette formation-là des sages-femmes, des médecins, des infirmiers dans les autres régions. On a 23 régions et on a pu atteindre une quinzaine de régions au Tchad où on a formé le personnel de santé dans la prévention et le contrôle des infections. Et on a également augmenté aussi les équipements de protection individuelle et autres, parce que là, il n'y en avait pas avant. Et c'était même pour ça que les infirmiers, les sages-femmes avaient été parmi les premières victimes. Et on a eu même pas mal de décès aussi parmi ce personnel-là. Donc, on a amené ça au niveau du pays. Voilà, merci. Merci.
Thanks so much, Dr. Grace. We just have a few more minutes, and I thought I would go to one of our other panelists to maybe speak to her experience. So this question is for patients, and wonder if you can speak to the situation in Malawi
Merci.
in terms of what difference it made to be prepared.
Okay. Merci.
And specifically around COVID. If you would like to.
Thank you. Yeah, just to go back to what I think some of what I shared. The COVID pandemic came with its own set of crises. And I mean, it's a crisis that was huge in proportion. And as a country, I think the immediate thing was, what do we do? How do we respond to COVID-19? When the government was trying to review, I think the major challenge has been, how do we allocate resources amongst the little resources that we have already? Our health systems were constrained in how we can respond to COVID-19. So within that, I think what mattered was, how do we look at where we're coming from and where we're going? It was a challenge really to have reproductive health services being put at the forefront, but it was easier having had the demonstrated case from Cyclone Idai, and I think it was still fresh in the government's memory, the Department of Disaster. And we were still like building on from the effects of the Cyclone Idai. So within that, you'd find that we've realized that prepositioning of supplies and having responders put in place, already prepositioned just to know when something happens, how do we reach out to them, and those supplies, how do we distribute quickly? My colleague, Dr. Said, said the prepositioning of supplies matters. Every other kit, don't underestimate its need. Prepositioning, it matters. And it was also easy for the reproductive health cluster to push for essential SRHR services and the need to integrate, for the need for integration during the COVID with the understanding of MISP. The MISP, when you look at it, it's like minimal initial service package. Within that, it articulates the areas that we need to pay attention to. And within that, you'd find that there is integration, gender-based, attending to gender-based violence survivors, and also at the same time, there is reducing maternal neonatal deaths. There is reducing and preventing transmission of HIV within that. So those multiple issues that we're trying to understand and ensuring that there is continuity allows for integration of services, and also the response that would look at multiple layers of how do you respond to issues. So COVID, again, presented that bigger challenge, because I think when we're looking at COVID, immediately when it hit the country, there was that kind of pushback to say everybody was a suspect. You didn't have testing kits. How do I know? How do I trust? More especially healthcare with the ones that were pushing back to say, how do I know that the person that I'm handling is okay? So that pushback. But eventually, when we quickly built in the systems, the integration was key to say, please understand the context of this, to say, you're not only treating COVID-19, but also a woman who needs the reproductive health services. And also another key aspect was the coordination. The subcluster had really various players coming into the cluster just to understand in how they can respond at multiple levels. At national level, who does what? At district level, who does what? And also I articulated more on the community level, the need to link up with the youth networks everybody had a role. The gender champions, they came in with their evidence, with their identifying gaps at a community level. So that alone helped us quickly respond to issues and see what can be done and what we need to take forward. Thank you.
Excuse me, Patience. Thank you so much for that really thoughtful response and all it covered. I think we are at time now, and I will turn this back to Beth Schlechter.
Thank you so much, Sandra, and thank you so much to all of our panelists. This really shows the global scope of our work on preparedness, and I know many of us have been saying since COVID struck, and Dr. Khanna mentioned this as well, that it really highlights that if you're not prepared for a crisis, then you're really not doing your work ahead of time, because crisis will hit, whether it's from a natural disaster, a global pandemic, or perhaps violence in communities and in countries. And so we owe it to each other, to ourselves, and to our families to be prepared for that. So at this, it's my great honor now to introduce all of you to Baroness Sugg. Baroness Sugg has been a minister at the Foreign and Commonwealth Development Office since September of 2020. And Baroness Sugg's ministerial portfolio includes gender equality, sexual and reproductive health and rights, children, youth and education, and inclusive societies. And again, we remain deeply grateful to the UK government and the people of the United Kingdom for providing the resources for this toolkit. So Baroness Sugg, over to you.
Thank you so much, Beth, and thank you everyone for your really important contributions today. I wanted to start by reflecting on the 2017 Family Planning Summit in London, which really was a pivotal moment where the needs of women and girls in crises were firmly put on the global family planning agenda. And we saw significant commitments made by countries and donors and civil society to address what we all know, that women and girls need access to sexual and reproductive health services in crises, and in fact, it may be when they need it most. And we acknowledge that it's possible to deliver SRH services in these settings, and we heeded the call from women and girls themselves that they want these services. But we would not have achieved such success without Jen Schlecht. And Jen was pivotal in the humanitarian working group for the summit. She represented the interagency working group on reproductive health in crises. And with that, she passionately and skillfully represented the community and built on the years of hard work by many of you who are attending the meeting today. Jen then played a leading role on humanitarian preparedness and response at the FP 2020 Secretariat. And I'm really privileged to be here today to help launch this preparedness toolkit, which we supported with UK aid. It feels like a really appropriate way to honour Jen's memory and to mark such an important milestone in achieving what we all set out to do in 2017. And it's really wonderful that her family are here today. COVID-19 have shown us many things. It's particularly that we've got to do better to prepare for crises. And Natalia described really well the human cost of crises, which are at an all-time high. We know that we need funding to be able to keep pace with those needs, and we know that the funding we need isn't available. And with these constraints, we can't afford to be unprepared for crises in the future. On average, every $1 invested in emergency preparedness, we can save $2.60 for the next crisis. So the way we approach crises needs a systematic change towards greater preparedness, anticipatory approaches, and resilience programming. And for far too long, sexual and reproductive health has not been prioritised in normal times and in crises. And as we all know, that can really have terrible ramifications for women, girls and their families, particularly when they're at the most vulnerable. And where country health systems are weak in normal times, the policies and the budget allocations, the workforce capacity and commodity supplies, it's really a tall order to expect a fast and comprehensive sexual and reproductive health response at a time of crisis. So it's better to have upfront thinking about the preparedness of SRHR services and how they can make a really big difference to an emergency response. And the toolkit outlines how we must continue to prioritise, safeguard and invest in sexual and reproductive health, including as part of health system strengthening and UHC. A really good example of UK support in this area is our 425 million UNFPA supplies programme, which I'm incredibly proud of. Through a new operating model next year, that's going to help drive an increased focus on strengthening countries' supply system preparedness and response. And as we improve preparedness, we can't ignore the key role of local actors, including, of course, women's rights organisations. They are the constant presence with local relationships, skills and expertise, and the first responders. And investing in their capacity in a truly sustainable way is good preparedness. The UK supports a range of mechanisms that reach local actors, but we know that this area remains underfunded, and the FCGA, my department, is therefore working to make sure that we're building our support to women's rights organisations, including through new efforts we hope to start next year. So COVID-19 has really laid bare many of the challenges we have long been grappling with, but it has offered some opportunities to build systems. For example, in Mozambique, family planning was categorised by the government as an essential service early on. And that meant that our flagship programme, WISH, was able to continue services and nearly tripled its quarterly target. And in South Sudan and Somalia, our WISH partner, the International Rescue Committee, has already been training service providers in the MISP. And this enabled the continuation of services in the pandemic, and they actually saw a 25% increase in services access to services between July and September across both countries. And during this crisis, we're witnessing more remote care, self-care, task shifting, supply chain strengthening, and policy changes. And these measures, I really hope, will leave many countries in a stronger position if they experience future disasters. And looking ahead, as FP 2020 in its current form draws to a close, we've been shaping the next phase of the Global Family Planning Partnership, which will launch next year. And we know that strong systems and humanitarian preparedness and response will be really central. And we hope that country leadership can grow in those areas. We've seen the difference that country commitments to make. At the 2017 summit, Bangladesh made the most comprehensive commitments to family planning and emergencies, and significant strides to be made to deliver them. And there's still major challenges. The Rohingya refugee crisis is one of the strongest examples of sexual and reproductive health being integrated from the outset of a response. So I am hopeful and helpful about what can be achieved. And this toolkit really plays an important part in that journey. I really want to thank Beth and Lorelei and the FP 2020 team for your continued work and your incredible commitment. And of course, thank you to Natalia for your leadership and for UNFPA's critical work in this area. The UK continues to be a fierce champion for the rights of women, girls and marginalised populations affected by crises. And we stand with you as we work together to really ensure that they can access the sexual and reproductive health services that they need, that they want and what they deserve. Thank you.
Thank you, Baroness Sugg, and thank you, Natalia, as well. It's been a very rich morning and conversation, and I'd like to leave everybody with some thoughts about next steps that we might take together in the months and the years to come. I encourage governments, government officials, humanitarian and development actors, and civil society organizations representing crisis-affected populations to come together to make strong commitments to building country and subnational preparedness and resilience plans and capacities. We'll be launching our toolkit for the 2030 commitments formally in January, and we look forward to partnering with all of you with that critical work. As Baroness Sugg mentioned, we're working intensively to craft the next iteration of our family planning partnership for the decade to come, and we'll be working on that throughout 2021, and we look forward to everyone's partnership in that endeavor. So you can also go to the FP 2020 website now to access the Ready to Save Lives Toolkit, where you will also have a chance to learn from other countries' experiences and consider taking the recommended preparedness steps. You can also consider joining the IWAG Emergency Preparedness and Resilience Sub-Working Group to share your experience and learn from others. There was also a question in the Q&A about how family planning practitioners are working together with others, particularly in the GBV sector, to bring these efforts together. And it's really through the IWAG sub-working groups that we hope to take that work forward as well. We also want you to consider please sharing your preparedness experiences during meetings and consultations next year, including the International Conference on Family Planning. We'll be having a session in February, and then again, we hope, in person in November in 2021. We know the IWAG is also working to have their scheduled meeting in 2021 as well. So continuing to learn from each other is an important opportunity. And if FP 2020 has taught us, or 2020 has taught us anything, it's that it's never too early for health systems to incorporate preparedness for sexual and reproductive health. Effective crisis response depends on building preparedness into sexual and reproductive health and health system strengthening efforts. And the Ready to Save Lives Toolkit gives us a roadmap for steps that we can take together. Being prepared will save lives, save resources, and maintain the development gains we've already made on our march toward the achievement of the Sustainable Development Goals. Next slide, please. So I'd like to thank all of our speakers sincerely. Dr. Cannon and Baroness Sugg for making the case for preparedness as a life-saving and cost-effective, and to Lorelei for previewing the Toolkit today. We're grateful to the UK Foreign, Commonwealth and Development Office for their financial support for this toolkit. I'd like to thank Dr. Grace Kadindo, Ms. Patience Mngoli Mwale, Dr. Saeed Kamal Shah, and Ms. Sandy Krause for such a stimulating discussion of experiences from countries in conflict and countries coping with natural disasters, and for offering your perspectives as government officials and NGOs. I appreciate that you shared your insights on your challenges and successes, and I look forward to our continued partnership with you and your colleagues on emergency preparedness and resilience efforts for sexual and reproductive health. And my heartfelt appreciation to our longstanding partners at IPPF, JSI, Women's Refugee Commission, and UNFPA, without whom we could not have completed this ambitious effort. You were thought partners to Jen, friends to Jen, and after her death, you dug deep and found the strength to see this project through to completion. So today we celebrate your dedication as well. I also want to thank the Schlecht family for being with us today. I know it meant a lot to all of us. You have colleagues and friends here of Jen who worked with her in countries around the world, Pakistan, Chad, Malawi, and so many others who aren't speaking today. So we want you to know how much we loved and appreciated working with Jen, how much we learned from all of her, and I hope that you feel how inspired we all were to be her friend and her colleague. And we hope that we can share that we've shared that with you today as well. So finally, I'll just say that the content of the toolkit was developed with the generous contributions of time and insight from more than 80 government, humanitarian, and development actors from around the globe. We're grateful to the 35 sexual and reproductive health and emergency and disaster management experts who reviewed the toolkit, especially since they made time to provide thoughtful comments while responding to the COVID-19 pandemic. These dedicated professionals are paving the way for other actors to strengthen their own health systems to be able to robustly respond to all types of emergencies and meet the sexual and reproductive health needs of crisis-affected populations. So thank you everybody for being with us today. Thank you for your partnership, and we look forward to working with you through the end of this year and in the decade ahead. Please stay safe, take care of one another. For those here in the United States, I wish you a happy Thanksgiving. It's the best of holidays because it's just an opportunity to give thanks to the things in our lives that are the most meaningful. From FE 2020, we give thanks to all of our partners. Be safe, and we'll see you again soon. Bye-bye.